Hello, my name is Tamara, and here at Beauty in Prague we are very excited that next week Gerard, one of the contestants from The Biggest Losers, UK, is coming over here to Prague to have his surgery done with us. Gerard lost an amazing amount of weight, 12 stones. He went down from 23 stones to 11 stones. And this, however, left him with some excess skin on his abdomen, so he is planning to undergo tummy tuck surgery with us. Gerard will be arriving to Prague next Monday, and his surgery is on the following day, on Tuesday, June 17th. So we thought you would like to find out more information about such surgeries which are possible after such major weight loss. To explain you more, I invited Dr. Ales Nejedly, who will be answering some of your questions or basic questions about surgery which is needed after major weight loss. Dr. Ales Nejedly is one of the most experienced plastic surgeons in the Czech Republic, and he has been performing cosmetic and plastic surgery procedures over 30 years. So could you explain us a little bit more about surgeries after major weight loss, especially on our male clients?
The weight loss by a man is characterized by loss of the subskin, the fat tissue, and of some reduction of the skin. But not all the skin is able to be retracted. What's probably interesting is that these types of procedures are a little bit different from typical abdominoplasties and breast surgeries, because when the patient loses weight and subskin and fat tissue, they lose the fat tissue, but they do not lose the blood supply that originally took care about the blood supply of the fat tissue. What I would like to explain, that there are too much vessels to be treated by the procedure, and so in the short course post-op may come to some more complication than by a typical abdominoplasties, in the sense of bleeding, post-op bleeding, and of the appearance of seromas and so on and so on.
So if you could tell us something more, what do you think, who is the ideal candidate for such surgery?
The good candidate is a man who lost weight and find himself in so-called steady state of the weight. For instance, for half a year or a year is on same weight level.
Please explain to us what type of procedures are required by clients, especially male clients, after major weight loss.
As we mentioned shortly before, there are just two areas mainly corrected after the weight loss. First is the breast, and second is the abdominal part. You may say that it's not just one procedure for each of these parts. It's very individual. It depends on the excess of the skin, of the status of the subskin fat tissue. So there are more procedures in the breast area, and minimum three types of procedures in the abdominal part. In the abdominal part, we may do just mini abdominoplasty, or we may do typical abdominoplasty, or if the overlay of the skin is large or is in great extent, so we have to use a procedure what is not too frequently used in the sense of abdominoplasty, like anchor type of the final scar.
Our clinic is very sought after, especially by clients coming from the UK and Ireland. What do you think, what are the conditions which client needs to fulfill so his surgery is successful and also his post-operative recovery is well and he is happy with the final outcome of his surgery?
If someone likes to undergo the procedure at our department, so we are accustomed to indicate these procedures according to photos. But probably, I can tell it's a rather complicated way, but we are able to decide whether the procedure may be done or not. What is good is that the patient stay in Prague minimal 10 to 12 days after the procedure. So he needs some 2 weeks for this all treatment.
Thank you very much, Dr. Nejedly, for all your answers. We hope we answered all of your questions or some of the questions and provided you with some useful information. We also have a message for Gerard. So Gerard, we are all ready for your arrival. Everything is ready for your surgery, for your arrival. Stay in Prague. And we all would like to wish you a safe flight, and we are looking forward to meeting you in Prague.